Hi everyone, this is Mike Poling. I'm Executive Vice President and General Manager of Healthcare at Infor. Thank you very much for attending today. For the customers that are in attendance, I want to say thank you. Thank you for being a customer. Thank you again for your time. And more importantly, thank you for the service that you're providing your communities during this very, very difficult time. It's very appreciated. For the partners that are in attendance, thank you. Thank you for being an Infor partner, and thank you for helping to make our customers stronger as they look to drive efficiencies in labor and supplies. We have several sessions for you to attend. The first is that we've got sessions that really gear in on what our capabilities are during this time of pandemic. We do have some specific feature functions and products that can really be helpful. So we've got some sessions about that. We've got some sessions about our healthcare operations platform, which really describes the breadth of the capability that we have, and that we'd love for you to take advantage of the opportunity to look and see some of the recent developments, some of the recent products that we've added to the portfolio. So with that, I'll let you get on to the sessions. Please enjoy, sit back, relax, and take in the content, and sincerely hope that you find some things that will be helpful to you and to your organization. Thanks again for being an Infor customer. Be safe, be well, and be kind. Thank you.
Thank you, Mike. Hi, everybody. I'm Chuck Winnie, Senior Director of Healthcare Strategy at Infor. I'm very excited to be here to talk about the industry trends that we discuss internally on a day-to-day basis and how we approach them in our delivery of both software and services for our clients. One of the biggest things that really hasn't changed much before COVID and mid-COVID is the expectation for clients to receive value. What has changed is the amount of value that they expect to receive. And that's one of the biggest areas that we're focused on, because we believe that the way that legacy ERP has been put together, only so much value can be extracted. Let's look at some of the high-level macro trends that we see pushing this. First off, elective procedures are fundamentally down. Even as of today, we're only about 80 to 85% back to where they are. And when the average margin in the country is only about 3%, that's not going to work out, because that's usually the source of your good revenue, as I call it. Patient expectations have also fundamentally changed. Nobody wants to sit in waiting rooms. People are much more open to telehealth visits. Of course, that brings its own wiggle as well, due to the changing nature of reimbursement and the fact that right now, nobody's paid very well on telehealth. So what does this mean? There's also fundamental core business changes that need to be looked at as well. So first off, organizations are asking, how do we get more value out of concepts like robotic process automation? How do we get more delivered analytics so we can look at critical item supply locations across the organization? How do we complement care delivery directly? We need to be able to have that PPE not just there, but ready for the right people. We're also hearing from things like our focus groups that we run that the payers are largely seeing a windfall. The patients that they serve are not going in and getting the routine care, the routine preventive maintenance and testing that they really should be. They're seeing a financial windfall, but they're fully expecting in the future that patients are going to come in with much higher acuity, requiring much more expensive care, and that's going to change the paradigm. So what we've been hearing from organizations is that we need to be able to support not just a more holistic look at the business of healthcare and the mission of a healthcare provider, but really the industry as a whole, and be able to support how do payers actually connect with providers, because whether it's via full M&A or via much more detailed partnerships and value-based care contracting, we believe that the future of healthcare is going to fundamentally look very different in a matter of 5 years.
Hello everyone, I'm Melissa Amel, one of the Healthcare Strategy Directors here at Infor. And in my role, I collaborate with other organizations, vendors, and providers to advise and guide Infor on the needs and opportunities in healthcare. The world we live in support in healthcare has completely changed due to the pandemic. Today is so different than it was 5 to 6 months ago, and we've had to quickly adapt to a new environment, not only professionally, but personally. Currently, there's a bit of uncertainty and a wait-and-see mentality driving healthcare to be more agile than ever before, leaving industry navigating the new normal, and we at Infor have also had to adapt to meet the needs of our customers. But one thing that hasn't changed is the ability for software and functionality to support the changing business operations in healthcare. Our healthcare clients on the operational and business side have seen dramatic change. In the area of finance, organizations are trying to understand the change in services and revenue and the new areas of cost and expense. What partnerships, investments, and/or consolidations make sense, leaving them questioning, is this just temporary or is this the new way to operate? In the area of human resources, organizations are now managing a hybrid workforce. Some are remote, some of them remain in the workplace. How do you create a culture of being together, being a team, and maintaining a cross-collaborative environment when you are separated? In some cases, leaders are not trained to manage a hybrid or remote workforce, which begs the question, how do you monitor productivity in this new environment? And then there is the area of supply chain. Operations I am very familiar with, having been a supply chain leader in healthcare for 20 years. This area is now the topic in mainstream media, and hopefully it'll get the attention and elevation it deserves. Organizations are now going to be forced to tackle some of the issues and inefficiencies that have plagued the healthcare supply chain for years. A couple areas of focus are the visibility upstream into the supply chain of distributors and manufacturers and where product is in the ordering and fulfillment cycle, especially for critical supply items that are used to care for patients and keep our caregivers safe. Right-sizing and diversifying inventory control, warehousing, and emergency preparedness. This will allow organizations to access the right product or piece of equipment at the right time. Even more vendor performance measurements and accountability reviews will be established, which will drive different partnerships, the way contracts are structured, and how products are sourced. And lastly, overall being able to assess needs before they happen through development of predictive modeling and forecasting, instead of solely depending on the past to predict the future. All of these will be areas of discussion and focus as we at Infor Healthcare continue to move forward.
Thank you very much, Melissa. These trends are exactly why Infor Healthcare believes that organizations need a new paradigm for how they look at business systems. They need to remain nimble. The next 6 months are going to be very turbulent, and the next 6 years, probably, hopefully not so much, but will probably be to some degree as well. As such, organizations need systems that help them do more than just count the beans and actually figure out how to connect the business of healthcare with the mission of healthcare such that they can provide better care for their populations. By including systems in our healthcare operations platform, such as time and attendance, such as equipment and facilities management, such as cost accounting directly in the core financial system, we are changing the paradigm of what people expect out of their systems. How do you extract value out of a concept like this? Think of it this way. You have nurses who go in, who need PPE, and they're not sure that the right size PPE is going to be there. Things that we are looking at include connecting all of those systems that I mentioned before, such that when a staff schedule is put together, it can look at HR and figure out what sizes people are, and then apply that to supply chain to make sure that the right PPE is there and ready to go for a particular person's shift.
Another area that has come to light in recent months is a renewed focus on patient and caregiver safety. At Infor Healthcare, we have developed integrated functionality to support the recall management process within the hospital. Our solution targets products that may put the organization at risk, identify where those products are in the organization, and eases the process of getting them removed and made unavailable to avoid accidental use. And when the business system and the clinical system are connected, identification of where these products are located is even more streamlined and efficient. This capability ensures that recalls are dealt with promptly and documented appropriately. As you are aware, deficiencies in these processes can lead to financial exposure and, more importantly, potentially put patients and caregivers at risk. This functionality can also support new item introductions, substitutions, and product conversions. Just think about the recent events that have happened around PPE, where organizations were dealing with allocations, back orders, and shortages, and ultimately asking the caregivers to use products that were not normally stocked or what they traditionally used. Our software helps you identify product and automate the replacement process, supporting what you deem as clinical or functional equivalent products for replacement. Think about all the departments and business processes that these examples affect, from supply chain to the nursing units, to the procedural areas, to risk management, and ultimately the patient. Another area that continues to have significant visibility is staffing optimization to reduce clinician burnout and improve caregiver and patient safety. Assigning staff and managing workloads can be a delicate balancing act. Infor Healthcare supports these challenges with patient acuity and workload management solution that provides a link between the patients being cared for and the nurses who care for them. This is just another way we continue to develop functionality to support patient care.
Another example of delivered functionality that we think is essential in this is the concept of homepages, which are much more than just a landing page that someone goes to. These comprise the task list of your individual workers, as well as all the information that a manager needs to comprehensively and efficiently do their job. If you're an AP manager, half of your life is probably managing the people on your team. So why not have on a single system, on a single screen, when you log in the morning, not just the list of all the people and who has clocked in and who hasn't, but also a list of all the invoices that they need to tend to that day. AP manager is obviously a little detailed, so the same concept really applies to the CFO. If we're already pulling in data like length of stay and patient days for things like cost accounting allocations, why not leverage that to look at things like supply cost per patient day directly on a CFO level dashboard or a CHRO level dashboard?
One example of how we at Infor Healthcare are supporting patient care through our functionality is Clinical Bridge powered by Cloverleaf. This is a key part of connecting the clinical system to the business system, not only functionally, but operationally. There are so many upstream and downstream business processes that this supports, and our functionality connects the way individual departments in the organization work with each other in both the clinical and business areas of the hospital in order to support overall patient care. This delivered integration will allow caregivers to focus on why they became a nurse or physician, and that is to deliver care and heal the patient, not to spend most of their time on administrative tasks. As an example, by maintaining products in the ERP as a system of record and sending them along with accurate pricing in real time over to the EMR, you allow this standardized information to be available to ensure the right items are picked, charted, and charged for in a surgery case. By standardizing and automating business processes and data, you can utilize functionality to enable and drive a more patient-focused environment. Another benefit that results is more timely and accurate reporting and analytics so that organizations can focus on outliers or areas of improvement to standardize, streamline, and reduce the cost of care. This is so central to our mission here at Infor Healthcare, and every time we look at opportunities to improve functionality, we ask the question, how will this positively impact the healthcare delivery system?
Another example of an area where organizations tell us they're looking for value that we're focusing on is the concept of continuous business improvement. When you have a great dashboard, you may have KPIs on there like vendor lead time. But what does that really tell you? If you surround it with a budget or a monthly trend over time, that may tell you if you're doing better or worse or if you're doing good compared to the budget, but it doesn't tell you where you have opportunities for improvement. As such, we have taken the concept of pre-built workflows based on the best practice experience that we've garnered through the years and through our Lawson clients, And we have layered onto that the capabilities to go through your audit logs and actually figure out how long each individual step is taking you. In the future, we're going to layer on the concept of benchmarking across other similar organizations so you can very quickly and easily see, wow, this individual step is adding 3 hours to every AP invoice getting approved. Do we need that step at all, or is that something we can layer on a concept like AI to figure out, is there a threshold where we should just be passing it through all the time anyway? These are great value-added concepts that enable you to see value and to reduce effort across the board. When considering our roadmap, we look at all the same concepts that we've just been discussing and take into account what our clients proactively are telling us. As such, what we're looking for are ways to further connect the business with the mission of healthcare via whatever we can deliver out of the box. Ideally, these things would all be connecting the business side with the clinical side. So when we look at delivered analytics, we very actively talk about how can we bring in more clinical data, normalize it so it actually makes sense and it's trusted, and then figure out how to do things more proactively with it that'll add immense value to organizations. Predictive modeling is a great example of that. How can you look at your supplies and figure out what you need in the future based on the data that you have today?
One area that they'll be focused on for further development is predictive modeling, forecasting, and demand planning. In the area of caregiver safety, we need a proactive approach. By collecting caregiver sizes, understanding where they work and when up front, we can better ensure the correct levels of product are stocked at the appropriate areas of the hospital during the time the caregiver works. Then, when you can pull in clinical protocols, treatment plans, and/or clinical formularies from the EHR, you can determine frequency to forecast out the anticipated need of these critical products to treat and care for patients based on their care plan. Then once you get data and operational procedures defined, you can use artificial intelligence and machine learning to automate this process and significantly reduce FTE time so that they can focus on other areas that drive value and support the overall goals and objectives of the organization. Unfortunately, today, this is a reactive, somewhat manual process in healthcare, and one where we need to use functionality and technology to meet the needs of the new environment.
Another roadmap item that we talk a lot about is how do we continue to connect all your information together so that you can do more direct costing. You shouldn't have to allocate everything. You should be able to look at the actual costs that you have because you know them and you know where they are coming from and actually analyze them based on their sources. So what does that mean? That means step one was actually getting our true cost tool directly built into finance. Step two that we're actively working on now is figuring out how to connect all those integrations together so you can get the direct costing. There's a lot of sources of data in the business systems, especially when you look at a full healthcare operations platform. So you need to connect in time and attendance, scheduling, payroll, the asset module, the supply chain. All of these aspects all have direct costs that most organizations treat as indirect costs today. A little bit down the road where we're really excited to go is bring in the concept of location-based intelligence and layer that on top as well so that you can even do time-based activity-based costing, should you so decide to, on your actual labor force. You can figure out when someone walked into a patient's room and walked out and directly attribute their salary, even their specific salary, to that particular patient. There's immense value here in being able to figure out how do we run the organization more efficiently.
Hello, this is Doug Abel. I am the Senior Vice President in Infor's Consulting Services for Healthcare. I want to thank you for taking a few minutes of your time today to spend with me. I want to share some thoughts on how Infor is thinking about driving success in the delivery of its solutions and approaches we can take to make that experience more successful in your journey. So before I do that, let me credential myself just a little bit. I've been in healthcare IT for nearly 40 years, and about a third of that time I've spent on the provider side of the marketplace, so on your side of the table. I've been an executive at multiple healthcare organizations, primarily as a CIO, but additionally, I've had the opportunity to run supply chain. So I've had the experience of sitting on a value analysis committee and debating the appropriateness of putting a 30-year knee into an 80-year patient. I've had the challenge of how to drive standardization across surgeons and physicians. I've also had the opportunity for 6 years to run emergency management for an organization. So as incident commander, I learned more about what it took to run a hospital than any other experience that I've had. Additionally, I've had the opportunity to work on the software side of the healthcare industry. So over multiple organizations, I've had the opportunity to build new methodology and new approaches to delivery, and that's part of what I bring to the table as I help Infor improve its approaches to delivery. So when I think about how we create a better experience for Infor customers as they go through an implementation process, I hold 3 or 4 key tenets in my mind. One is prescription. So how do we as Infor bring a point of view to the table? How do we take the collective learning we've had over our history in working with customers like you and begin to say, this is the appropriate way to configure the system to work for you? How do we eliminate the idea that we start with a blank piece of paper and say, well, what do you want to do? It's not that we don't listen to the input of customers, but most customers today are saying, how would you recommend? And that's what we want to bring to the table. Number 2 is repeatability. So if you want predictability, the only way you get there is with repeatability. In repeatability, it's how do we reuse elements that we've created before? How do we manage variance? Because in the end, you've heard the term variance is the enemy of quality. I think that plays very true in the way we deliver software. So we need to be very deliberate in our approach to managing that variance. And then 3, how do we speed up or accelerate our processes? And the only way to do that is to eliminate work, reduce work effort, eliminate hands on keyboards, as I say. So with those 3 tenets, you can create predictability. You can begin to say, here are the outcomes you will get because we are highly prescriptive, highly repeatable, and we get to the end point much quicker. So I want to thank you for your time today. I look forward to working with you on our journey to that success. And in parting, I want to leave you with 2 things that I've learned through my career. Number 1 is I think we are infinitely more alike than we are different. So we have to leverage that collective knowledge and experience and learning and go faster. We've got to stop using the blank piece of paper approach to implementations. And number 2, we have to simplify. The world is complex, and anything we can do to simplify our approaches and processes are key. So I'll leave you with a quote that always guides me. And that quote is, perfection is not achieved when there's nothing left to add, but when there's nothing left to take away. So with that, once again, I thank you.
Hi, my name is Matt Wilson, Senior Vice President at Infor Healthcare. This is truly an extraordinary time to be a part of this company, and it's a great time to be one of our clients or valued consulting partners. Over the last 25 minutes or so, Doug, Melissa, and Chuck have taken you through a variety of information, from describing our now mature healthcare operations platform to talking about proven implementation and adoption methodologies that have shown in healthcare to provide higher levels of reliability, predictability, and value at an accelerated pace. I want to assure you, though, as a senior leader of the business, that we're also here to engage with you differently. Over these past many months, we've listened, and we've now rebuilt the way we engage and support you across a host of your needs. We've also reshaped the way we educate and enable you, making sure that you have the tools, education, and access that you need to continue success over the long term. Finally, what we're looking to do here at Infor Healthcare is to make sure that we're connecting the business of healthcare with your mission. Focusing on patient outcomes and not just business operations is something that we together can do to bring broad improvement. We want to be with you for the long haul, whether it's improving your role, your service line, or whether it's contributing to the long-term financial health of the organization that you work for. We want to partner with you in that endeavor, and we want to be there for you every step of the way. So, on behalf of all of the employees at Infor Healthcare, thank you so much for spending these last minutes with us, and we look forward to serving you in the future. Thanks so much.